Hi, my name is Jessica Moore, and I'm going to talk as fast as I can. This is just going to be part one of a series of videos that I want to send out to the world about my story. I, at 34 years of age, started to have some pain right here, my right temple. Before that, I was very active, went to spin class 3 times a week, went jogging, did Tai Bo. I have 2 beautiful children, both girls. Worked at my job for 12 years. Wasn't quite sure what was going on, had my eyes checked, my teeth checked, had regular physical exam. Just went about my business on a regular, got up, my makeup on, my 5-inch heels, my business suits, because I just figured, I don't know, like, how does somebody just have pain in one area of their head, and medication like Advil or ibuprofen, those are the same things. I don't know. Anyway, so long story short, for this part, I went and saw a neuro-ophthalmologist who belittled me. On my paperwork, I said I had the pain 24/7, and basically in the 5-minute exam, he said, "Does it hurt right now? How about now? Do you have the pain now? Do you still have the pain?" Sent me on my merry way with a bag of sample migraine medication and a list of foods and drinks to exclude from my diet. Also ordered an MRI that came back negative and had his receptionist call me to give me that information. I then asked her, "Well, do you have any suggestions of what I should do next because I'm still experiencing the pain?" She's like, "No, nothing's wrong with you. You're fine." So my sister and I then walked into the ER at Suburban here in Maryland in the Washington, D.C. area, and I explained my symptoms to a doctor, and we were then accused of wanting narcotics. My sister sort of flipped out because she's my older protective sister. I was given a steroid pack of like methadone. It was like a mixture, and I had to take it for 5 days. So the next morning I woke up, took the first 2 pills, took my daughters to school, had to pull over, couldn't breathe, was passing out, took a nice little ambulance ride back to Suburban, was then hooked up to a bunch of machines, had a lot of testing done, and was referred to a neurologist, Dr. Statinsky, who became my hero, my advocate, very nice man, listened to me, always returned phone calls, took time to really try to figure out what was wrong with me. Unfortunately, he couldn't help me. He didn't know. Sent me up to Philadelphia to the Thomas Jefferson Headache Institute, where I met with Dr. Silverstein, who is one of the top doctors who basically deals with migraine patients. So I had Botox treatments, was put on a lot of medications with horrible side effects, didn't take the pain away, nothing was working. Decided that the Philly trips were unsuccessful. They wanted to give me lidocaine infusion, IV infusions. I read about them online, didn't want to have the high risks, so I went back to Dr. Satinsky, and he then referred me to Dr. Duchik on August 6, 2010 at Georgetown University, and that is where I answered a series of questions, and we decided that I needed to have peripheral nerve surgery. At the time that I first met with Dr. Duchik in 2010, he told me he had only conducted roughly 200 to 300 of these surgeries, which seems like a lot, but isn't. I said, let's schedule the surgery, let's have it done. I had no other choice. And I'm going to end with this, and I will pick up with my first surgery.